Welcome back to In the Gray Area with Rev Health. I'm Brittany.
And I'm Travin.
Today's guest is someone who shares our heart for real wellness and whole body healing. Mariah Frisella is a nurse and the founder of Origin Wellness in New Hampshire, where she helps both men and women get to the root of what's really going on in their bodies. We're so excited to have her here with us today.
Yeah, Mariah, we're so excited for you to be here. Britt and I were just talking before the podcast that was so much fun when we met up with you and Nate that time, and just how we all met. And I think, you and Brittany had, I think, connected on social media, and we're just like chatting a little bit. And Britt and I were down in Florida on vacation, and you guys happened to be there, I think, visiting some family at the same time. And so we each drove like hour and a half or something, kind of met in the middle, and just like, God, we sat and hit it off immediately. And I think we chatted for like 3 or 4 hours, and it just like flew by. We all had so much in common.
I know. It was so good to finally meet you guys in person. It's the beauty of social media, I think, brings people together. And it felt like, I think Nate and I both felt like we were just catching up with old friends, even though it was the first time we met you guys. And after we left, we were like, shoot, we should have got a picture all together and captured this moment, because who knows when the stars are going to align again and we're going to be kind of in Florida or in the same state together again. But
I know that would have been good. We're both so bad about taking pictures. We do that all the time after the fact. We're like, dang it, we forgot photos again.
So I think that both of our stories are just so relatable too. Maybe you can kind of just give us a little bit about your background in nursing and why you created the clinic that you now have.
yeah, absolutely. So I've been a registered nurse for 14 years. Kind of weird even saying that and thinking about that, but my nursing career has taken me to a lot of different places. I started out in ICU in the hospital. Pretty quickly after that, about a year after that, I transitioned into the outpatient world. So I went anywhere from family practice to many years in management of medical and surgical practices, and then kind of finished up my corporate career in orthopedic surgery, which was really fun and exciting, but started to open my eyes into a different side of health, personally and then quickly professionally, that I wanted to start exploring. I started getting a vibe from mainstream medicine that we aren't really treating the root cause. We're looking at a problem that's very preventable and just pushing medications at it, where most of these problems and processes and comorbidities can be really prevented if we just have a lot of education up front, if we're taking preventative measures, if we're optimizing health. And that wasn't really condoned in the corporate environment that I was in. So I kind of had to look at alternatives. And for me, that meant starting my own practice.
I love that you said that about, preventative, because so many of these diseases are preventative, but unfortunately, like, our healthcare system is set up to just be reactive and wait until the disease progresses or it's already here before we start treating it, rather than preventing it from ever happening in the first place. And I know one of our biggest challenges in just when we're working with patients or prospective new patients is just so many people want their insurance to cover this kind of treatment. And unfortunately, it is totally set up to just be reactive, like you said. And so it's like getting people to have that mindset of investing in their health and being proactive about it and taking it into their own hands is like a huge hurdle that we face a lot.
It's probably one of our number one, I would say. Sometimes it's the first question that we even get from people when they reach out is, do you guys take insurance?
Yeah, I get asked that question quite a bit as well. And I think if we start to look at it in a different light, it's like, if we're not going to go to our homeowners insurance and ask them to help us do remodels in our home, right? So we can't really look at our insurance that way either. If we're starting to optimize and really wanting to get more out of our own health and wellness, unfortunately, our insurance company just isn't there for that. So oftentimes this means we have to pay out of pocket, but in my opinion, and maybe you guys share the same opinion, you really kind of get what you pay for. And if you're looking to get the most out of your life, you need to start investing in that. It's no different than our savings account. We put money away for our 401k for our retirement, but we want to get to that point, right? And that means we have to invest in ourselves, in our wellness as well.
Yeah, absolutely. I think your body and your livelihood is definitely something you don't want to like go the budget route on and try to like find the cheapest option possible. I mean, that should be something that you first and foremost, like, okay, I'm going to make a good investment and I'm going to make sure that I can actually enjoy life, like you said, like later in years and when you retire and have the freedom. But it's so important. But unfortunately, I think a lot of people don't come to that conclusion until it's too late, or at least it's progressed pretty far.
It's been interesting though, because we have had a few patients that they come to us, we get them like optimized, all dialed in, and then they go talk to maybe their nurse practitioner or, you know, get somebody else involved, another provider, where they say, oh, well, I can do the same thing and you can go through insurance. And then they try that for maybe like 3 to 6 months. And then they do end up coming back. And they're like, man, even that testosterone cream that I got from, my other doctor, it's just not the same. So, I mean, we are seeing that too. Like people are waking up and realizing that there is a huge difference and that it does take that initial investment on their health.
Yeah, certainly. And I think it also starts to pique the interest of the consumer, right? We're now providing this value and this information to our clients, and they're now going back to their primary cares or their OBGYNs or their urologists and saying, "Hey, what do you think about testosterone replacement?" And, my providers over here really think it's safe, and they're giving me all this evidence showing that it's actually going to help me long term and maybe prevent um, some comorbidities or some illnesses. What do you think? And, I'm really hoping that in time we're starting to see a little bit of a shift, at least in the primary cares. I don't think we can expect that they're going to be prescribing this or managing this, but at least saying, you know what, I think that's a valid point that you have. This is going to prevent things long term. You should stay, with your outside providers and continue on with that therapy.
Yeah. Yeah. In your practice, have you seen a lot of conflict with patients that, get their other providers or maybe their primary care doctor involved and kind of give them conflicting advice on what they're doing with you in regards to the hormones?
Absolutely. And it's a really fine line that we tote, right? Because with the primary care providers, the last thing that we want to do is um, question maybe or put doubt in our client's mind, like your primary care isn't really right when they say this, because maybe that doesn't put a lot of trust and faith in us. But I have found providing that evidence to them and saying, why don't you take this research study and next time you talk to your primary care, why don't you bring that to them? Or maybe these are some questions that you can ask them, and say, why are you hesitant on this? These are some studies, and hopefully we can start to shift the mindset overall. But the more we peel back the onion, especially with the primary care, with the OBGYNs and urologists, we're finding the consumer or the client is just not putting a lot of trust into them because of all these other health issues that they might have that they've been wronged by.
Yeah, you're so right. It is a very delicate conversation to have with your patient about having these conversations with their primary care doctor, because you're right, you don't want to come across that they shouldn't trust them or create a doubt there. But, we especially have learned that, in the years that we've been doing this, it's like trying to have that conversation with the patient up front, like when they kind of sign up and they get started of like, hey, like we caution you about getting your primary care doctor involved in your hormone care because, and we just try to frame it as like, we're very specialized in this. They probably have had very little, if any, training on it. And so it's just kind of not their wheelhouse. And so getting them involved will just kind of muddy the waters and cause confusion for you. And so it's best to just avoid that altogether. And we try to kind of frame that up front, but
We try.
I mean, yeah, we can't, we can't control it, but some people do a good job with it. Some people absolutely do not.
I think the hardest part too is like once they do go to their primary doctor, then they have a ton of fear. And so then we're kind of faced with that and overcoming and just also giving them an ease of being like, okay, well, how do you feel? And they're like, I feel amazing. I haven't felt this way in years. And it's like, okay, so do you have any negative side effects? Well, no. And so just like you said, showing them even that, the evidence behind all of it still is so hard because they put so much trust in their primary doctor.
Yeah, they do. But sometimes the more that we start to talk with them, I just have recently just had a couple male clients that came in and we start talking about baseline testosterone levels. And one of the biggest symptoms that they didn't even think was related to low testosterone was depression and mood changes. And when I start to bring that up of, have you had mood changes? Have you had any depressive bouts? Oh yeah, my doctor put me on an antidepressant, an SSRI, Prozac. How are you feeling about that? Not great. Okay, so that could be because of low testosterone. So we're not going to manage the depression medication, but maybe a little bit of testosterone may help you to get off of these depression medications. The wheels start turning at that point for the client, like, wow, I'm figuring out the root cause instead of just giving a pill that I wasn't really okay with, but my symptoms were so bad and so depressive that I needed something in the moment. Um, and that's huge. But also when we think of primary cares, um, I hate to even say this, but they went to school for one thing. It's to find the problem and to find the medication to treat that problem. It's not truly to help to optimize or to find the root cause necessarily. So we have to take what they do at face value, and there's certainly a time and a place for that. But we are now in a completely different realm of health and wellness, and I think this is where health is headed long term.
I love having that conversation about the depression and testosterone because you're right. It they go hand in hand, and so many guys come in, like you said, that are on an SSRI because they went to their doctor with these issues, and it's like, okay, so you had the low testosterone, we put you on the SSRI, and oh, by the way, that's even making the ED worse that you had already from having low testosterone, and it's just like these things are like compounding the issues rather than even addressing it at all in the first place. And it's like you said, when you kind of explain that to them and you see the light go off and it's like, oh my gosh, it's like I can, you know, fix my depression. Oh, and I can, gain muscle easier. Oh, and I can lose body fat easier. And I can, improve my sexual performance. Like all these benefits that come with it. And it's like a no brainer.
Yeah, I think even just explaining that I mean, you just explaining that lifts moods, right? Like there's hope
Yeah.
Yeah.
there instead of like, I need to take this pill forever.
Right.
No, you might not need to,
Hmm.
right?
Yeah, absolutely.
And that's all that people really need is that little glimpse of hope. And we hear that a lot. We'll get messages on Instagram where people are like, can this really help me? Do I have hope? Is this going to make a difference for me? They always think that it might help other people and not themselves. So it's incredible to see that transformation with people just being in such a low place and then actually feeling like they get their life back.
Yeah, I recently just had a male client of ours reach out and say that he was kind of underplaying how depressed he was when he came in for his consultation, but apparently he was suicidal and ended up sharing this with me about 2 or 3 months after starting testosterone and saying that it saved his life literally because he was such in a low point and he knew his testosterone was low, but his primary wouldn't help him with that. Just getting on a low dose. He said, I can't, his words, I can't even make myself sad at this point. I just,
Yes, that's
and
amazing.
we were both crying when, like him and I were both crying hearing this. I was so happy for him.
Yeah. I mean, those are the stories that really make us like, that's why we do what we do. And it's like, that's such a rewarding part about all this is hearing that stuff every day. It's amazing.
Absolutely. I mean, I've owned the clinic for 3 years now, and prior to this, I don't think I ever felt this way about going to work and helping my patients. I love
Absolutely.
them all so much, but um, I never really got this excited about going to work.
We say that all the time, and we genuinely get so excited every single day to come in and do what we do and help people. And it's very rewarding and we love it.
It's also really nice to actually be that advocate for other people because, like, all of us have different stories. But with mine, I was super sick. And I was bouncing around to different doctors and getting different, like, answers or not getting any answers and then feeling desperate and not feeling like I had any hope. I actually remember at one point, like, I was very much okay with feeling horrible, which is horrible to even like wrap your head around. Like,
Hmm.
I was okay with this just because I wasn't getting any answers. And so, to be able to have places like yours and ours where we can be that voice for other people that get to that place of feeling hopeless is incredible. And just getting more awareness out there. I think people have no clue. And there's been this like negative stigma behind hormone replacement therapy for way too long.
Yeah. Well, I mean, so many people like you were they come to the conclusion of just accepting feeling like that. And especially when they're told that over and over. And, a lot of people go through this desperation phase where they're bouncing around or they've seen several different doctors or specialists and they try to figure out what's going on with them. And then, at the end of the day, it's basically like, well, you're just getting older and these things are normal and it's part of aging. And that's what most people are told. And so they do just accept it.
Yeah. And I know I've said this more than once, but I literally had a doctor tell me that they call women crazy woman syndrome when they come in with these symptoms. So, I mean, it's just sad.
It is really sad. Now that you say this, it just strikes this memory that I have working in primary care. This was probably 12 years ago now. And one of the primary care docs that I worked with said the same exact thing. He said, You watch, once I get a female client come in around age 35 to 45, we're going to put her on Ativan, we're going to put her on Ambien. She's going to say that she's losing her mind, she's having hot flashes, she's just crazy. And this is literally what his practice was. And at the time, that didn't resonate with me. I was in my early 20s. I'm like, okay, very still, like very new as a nurse. Um, Looking back, I'm like, wow, this is the culture of sick care, is what I call it, because it's not really healthcare. And it's sad. It's no wonder women feel helpless with this, even men. It's really just a sad way to practice medicine.
Yeah, I know that when we brought on our latest, our new provider, she said the same thing. She's like, I literally got even just 10 minutes with a patient too. And it was kind of like writing a script just to make them feel better and sending them on their way. And then getting at home at night and being like, gosh, I coulda, shoulda, woulda done this. And I didn't have enough time. And I mean, honestly, we see this like vicious cycle all the time,
Mhm.
especially even like with birth control and girls. Like sometimes we get girls coming in here and they're on like two different types of birth control.
It's unbelievable. I mean, we just in this past couple weeks, we have had a number of probably menopausal women at this point. They don't know because they have an IUD, and their primary or their OBGYN says, I don't want you to take the IUD out because I think your symptoms are going to be so much worse. Well, how do we know?
Yeah.
How do we know this? Like, why don't we take it out and see, and then
Yeah.
figure out the what's actually going on and treat that, not just throw an IUD in and call it a day because you don't want to hear from her for 10 years.
Mhm.
Um, but when we start to have a logical conversation and again, peel back that onion with the client, it's like they finally feel heard for the first time when they're going to their OB and their primary for all these different reasons and they're not feeling heard. They're feeling really dismissed when they are being dismissed.
Well, I think we all can agree that, the medical system itself is just messed up. And you really just have to be an advocate for your own health and you have to prioritize it and make an investment.
Yeah, for sure. I mean, we talked about that with, insurance and sick care. But it's, yeah, if you really want to, extend your life and add years to your life too, and actually like feel good as you age, I mean, yeah, you really have to take it into your own hands for sure.
But also, like when you are making that commitment with somebody in regards to like hormones and optimizing your health, you need to do your research when it comes to the clinic that you're working with. You need to fully trust who you're working with so that it's not as frustrating and confusing for everybody involved, including the patient. They need to be able to listen to what they're being told when they go in.
Yeah, I'm curious, Mariah, do you have these conversations with your patients about trying to avoid like Googling things or looking up things in groups and taking, outside advice from friends and things like that?
Yes and no. I mean, one of the best ways that we can start to talk about our health is just being open with it, right? Like so many of my clients at Origin relate to what my personal story and my struggles and why I got on hormone replacement therapy 5 or so years ago. So we do encourage our clients, hey, talk with a friend that you know is on testosterone. Why don't you talk to your friends that are menopausal? Talk to your mom, see what happened with her or your grandmother. And sometimes it helps and sometimes it doesn't. Or they'll say, oh, my grandmother went through all this stuff and she said, just suck it up. But I don't want to do that. No, there's more options. Um, we obviously Google is out there and WebMD, and everybody thinks that, they're a doctor after they look on WebMD. But there is still a lot of really good information on the internet. Some of it is not factual, so I do caution on that. But the beauty of social media as well, YouTube, we can educate ourselves so much better, and at least it just brings that discussion up and allows for some questions with our provider. If your provider does not know the answers to your questions or isn't at least willing to help you find the answers, that's probably a red flag.
That's a great point. I love that because at the end of the day, it's all about just creating awareness and trying to get as much good information out there as possible.
Yeah, absolutely. I mean, there's certain things with our clinic that we aren't experts on, and we're the first ones to say that, "Hey, that's not our expertise, but I'm committed to helping you find somebody that I trust and that our clinic trusts so that you can get that care." And again, if your providers aren't willing to do that, that might be something that you should look at a little bit deeper.
We 100% agree. That's kind of our philosophy as well.
Yeah. Well, I want to thank you for joining us today. And also, I want to let the listeners know where they can find you at.
So they can find us on Instagram and Facebook at Origin Wellness Co. They can find me personally at Mariah Frisella. We put quite a bit of content out there, just like you guys do. And I think just by adding that value, helps grow awareness in our community so much more.
Yes, thank you. And we really appreciate the relationship that we've been able to build with you too in this space.
Likewise.
Like always, thank you for joining us. Please like, share, comment, and subscribe. We will also include a link where you can find Mariah down below as well. And thank you for joining us. We will see you next time.